All right, so welcome to our interview. Mr. Patient, could you please state your name for me?
Bernie Van Hoovel.
Bernie Vanden Heuvel. Perfect. How old are you, Bernie?
I'm 22.
All right, perfect. How are you doing today?
Oh, I'm just doing great today. I can't complain.
Perfect. Glad to hear it. So, basically what we're gonna do is I'm gonna start by asking you just a few questions about your condition and why you're coming to PT, and then we're gonna go into our other PTs or student PTs to ask you a couple more questions about medical history and like your overall living situation. How does that sound for today?
Sounds great to me.
Awesome. Glad to hear it. So, what is the main reason that you're coming to physical therapy with us today?
Oh, my hamstring's kind of hurting me. I hurt it back in December and it hasn't healed yet.
Okay, well, I'm sorry to hear that, but let's hope that we're gonna get you straightened up and fixed. What side is that gonna be on? Left or right?
It's my left hamstring.
All right. So you said since December, was there anything before that that caused the injury at all?
Yeah, it was the week before Thanksgiving and I tweaked it and I thought nothing of it. And then I re-hurt it in December.
Okay. When you tweaked it, so you just do nothing about it, just kind of rested it that day?
Well, I rested it the rest of the day and then I went hunting and I was walking through the woods for about 14 hours that week. So I was kind of on it the whole time and it didn't bug me.
Okay. Sounds good. So what kind of symptoms did you notice? Like both when you were walking through the woods, like if you did you notice it then? Like was it bothering you then?
No, it didn't bug me before I heard it in December. I felt it, it felt like almost a cramp at the time though, when I
Oh,
first heard it.
okay. And then so now with this recurrent pain, how have you been? How would you describe that pain?
It feels like if I were to try to sprint or contract my hamstring very quickly and strongly, it feels like someone's stabbing me in the leg,
Okay.
specifically at the tendon of my hamstring.
Okay. Perfect. Um, so on a scale from 1 to 10, 1 being little pain, like you're good, chilling, uh, and 10 being you need to go to the emergency room right now, what would you rate your pain currently?
One,
A 1. Okay. What about at its worst? Like
probably about an eight.
an 8?
It only lasts it only lasts about half a second though, at an eight.
Okay, so it's just kind of like a quick twinge of that sharp pain type thing.
Yes.
Okay. When do you notice that?
If I were, so if you're jogging, you can kind of fall into your leg because you're not pulling your knee, like you're not closing your knee. But if I were to try to sprint and then contract my knee to accelerate forward, the contraction of my knee or like the flexion of my knee to sprint causes pain.
Okay. Okay. And then at its best, have you just had times where it's like nothing, like right now?
Usually, if I'm sitting down, like right now, it's fine. In the past, it's been like a constant, probably like a three, where it's like a just noticeable achiness. But as of now, it's fine.
Okay. Perfect. Oh, that answers one of my questions. Is there anything that you do like around like in your daily life, like that will recreate the pain?
It's only sometimes if I'm doing like maybe if I just like pick something up quickly or just do something weird and I contract that muscle,
Okay.
but it's
Sounds
very seldom.
okay. And then alleviation of the pain, just sitting. Have you done any like heat pack, ice pack?
Since that injury, the only thing that really helps it is just not doing anything. Because if there's been times where I've tweaked it, like where it's at that eight, and it'll stay at it like that achy level around like a four, whatever, for like weeks. And it doesn't really go away. But recently, I don't know, I've been trying to do like lift more weights just slowly, and it's kind of felt a little bit better. But I still can't actually like contract to sprint yet.
So it's felt better with the activity of the weightlifting.
So far, yes.
Okay. So strengthening has so far provided some result for you. Then I guess last thing from me, and then I'll pass you off to our other physical therapist Brady, who's one of our other ones who's here. Um, have you seen anyone else for this issue in the past, like physician, athletic trainer at school? Because you're a sprinter, from what I understand.
Yes, I've seen the athletic trainer at school.
Okay. What have they offered in terms of potential solutions or interventions?
They just gave me some lifts to do, and then we've been doing dry needling along with we've done e-stim once.
Okay, sounds good. All right. Well, thank you from my end. I'm going to pass you off to Brady for some couple other questions now.
How's it going, Bernie?
Oh, just great.
Okay, so I'm just gonna ask a handful of questions, just kind of about like your living situation. So, if what is your current living situation like right now?
I live in a house with a couple other guys. I live on the second floor. So one flight of stairs to get up to my room. Bathroom's on the same floor. The kitchen's downstairs. And we have our laundry room that's downstairs in the basement.
Okay, and then do these stairs have a railing at all?
They do have a railing.
Okay, and do you have to like once in a while if it starts acting up, do you have to use the railing to go up, or are you pretty are you pretty able to just walk up the stairs normally?
Usually it's not too bad because that's more, in my opinion, more of a quad. Like I feel like I'm using more of my quads to go up. I would say going down the stairs is can be more of an issue if it's hurting pretty bad, in which case I'll brace myself on the railing, yeah.
Okay, and then is there any other like tripping hazards or anything around in your apartment that's caused you any problems?
Nope, we're all wood floor here, so nothing for tripping hazards.
Okay, and then is there anything like around the house that you usually do that's kind of hindered by your injury?
Um, Not necessarily. Um, I mean the only thing would be maybe like squatting down to pick something up, but I haven't really had too much pain recently with that. So at the moment, nothing is really hindering me at my house.
Okay. And then you said you're living with a couple people, right?
Yes.
Would you say they're pretty supportive in case you need help at all for anything?
Yeah, a couple of them are pretty, one of them's pretty strong. The other one's not so much. So he
Okay.
can help me out if I need.
Okay. And then are you currently employed?
I am currently employed, yes.
Okay. Do you mind if I ask where you work?
Sure, I work at the school. I give tours, so I walk around quite a bit for the job.
So does your injury kind of hinder you when you do that?
Sometimes it can. Recently walking's been okay. Some days it'll be a little achy. But kind of sometimes once I start moving a little bit, it'll kind of dull down, or maybe I just forget about it because I'm talking the whole time.
Okay. And then you are a student, correct?
I am.
And I know you kind of said once in a while when you're sitting, it kind of acts up. Do you notice that when you're in school as well?
Some days I don't feel it, but there are days where it's just kind of like an ache for the full day.
Okay. We're just getting to the end of my questions here. And is there any like social limitations, like you're not able to do as many things like with friends or family as much because of this injury?
The only thing that really limits me socially would possibly be participating in stuff like track, like running, because at practice I just kind of stand around now. So that'd be the only limitation socially.
Okay. I do believe that answers all my questions. So I'll hand it over to Paige, and she's going to ask you some questions more related to kind of like your medical history.
Okay.
All right, so I'm just gonna finish it out. So, have you had any surgeries in the past, whether musculoskeletal or anything else?
I've had my tonsils taken out and I've had my wisdom teeth taken out.
Not like wisdom teeth. I hated it. All right, and have you had any lasting complications from those surgeries? Any problems, infection, anything?
I have not.
Mm, nice. Do you have any allergies or severe allergic reactions that required hospitalization?
I do not.
No, not allergic to meds, anything?
No allergies whatsoever.
All right. Do you have any other health conditions we should be aware of, like hypertension, high cholesterol, coronary artery disease, any of those?
Um, Nothing like that for me outside of the fact that I have Raynaud's. So sometimes stressful situations, like if I were to get a tooth filled, I would not be able to feel my hands.
Anytime during a test?
I've never experienced it during a test, but sometimes at home my toes will lock up on me because my toes actually get Raynaud's too.
Oh,
So, but that's doing homework assignments like neuro. then that'll happen.
All right. Are you taking any prescription medications or anything over the counter?
I am not.
No. Do you consume caffeine, coffee, tea, energy drinks, pre-workout?
Nothing like that enters my body besides milk.
It's milk.
Yep.
Do you smoke tobacco, nicotine?
Nope.
No. Do you drink alcohol?
I do not.
No.
No.
Right. And then any type of abuse in your childhood that you could remember?
Not that I can remember.
No. Is there any family history that would be important to know?
Well, my mom has a fused disc in her neck at C3. Um, my dad has hypertrophic cardiomyopathy, which is a heart condition. So his heart doesn't work. He has a pacemaker, which he's 100% dependent on. Um, my sister has hydrocephalus, but I don't have anything like that. Um, and with the hypertrophic cardiomyopathy, I've been tested for it. I don't have it genetically because my dad got it from a glycogen storage disorder, which I don't know if I've been tested for. So yeah,
So you're just the lucky one so far.
I am.
All right. And are there any other concerns that we can help you with besides your hamstring pain?
No, that's the only thing I'm coming in for today.
No. All right. That will conclude our interview then today. Thank you for participating, taking time out of your day. Really helpful. Of
It's my pleasure. I'm glad I'm getting treatment by you guys.
course, the best treatment possible.
Yes.
Thank you, Bernie.
Thanks,
No
Bernie.
problem. No problem.